Well, hello everyone. It's Mark and Ann, and we are back once again. How you doing, Ann?
I'm doing good. How are you doing?
Are you staying out of trouble?
Never, never. I'm
Well,
always in the middle of something.
you are. Who do we have with us today?
We have today, we have Tia Copeland.
Hmm.
Tia is currently with Affinity Bridgeway,
Hmm.
but Tia has a background in social work. She has worked also as an advocate with a partnership against domestic violence, so
Hmm.
P.A.D.V. That is near and dear to my heart. She is service coordinator. She was service coordinator, I'm sorry, with Wesley Woods Senior Living.
Okay.
So now she's working with hospice families as an advocate for them and trying to help them to navigate through, as you well know, um, all the things that go with aging and parents on hospice and those kind of things. And she's also experienced her own grandmama going through
Okay.
dementia, so she's been there. So I think she's probably a great advocate for her families, having experienced it herself.
Very good. Well, a lot
Yeah.
to talk about. So let's count this down and let's get this show going.
All right. Sounds great.
Tia Copeland, welcome to the show. Got her festive Christmas tree shining in the background, bringing on the Christmas spirit already. How you doing today?
Yay!
Definitely. We love during this time of year, we call it home for the holidays at Affinity because we really try to help the community and providers have people home for the holidays, whichever
Very
holiday they
good.
celebrate.
Aw,
Just this
that's
time of
great.
year.
Yeah.
Yeah.
Yeah,
And
that's
Angel
wonderful.
Phillips, thank you for saying that. We hope it's awesome. Hope you enjoy the show. So everybody kick back, relax, and let's find out a little bit more about Tia. So tell us a little bit about yourself, Tia.
So, as Ann introduced me, I do have a background in social work, and I've been a community advocate and service coordinator for some time. Also, proficient in community engagement. So, I kind of mix all those things together. And right now, I'm a community educator with Affinity Hospice. And so, what that means is that I meet with the community or providers or really anyone who would be in need of hospice care or wants to know more about it because it still has a lot of stigma behind it.
It really does. Yeah.
Does. It
Yes.
Yeah.
does. Yeah.
Well, just for the record, so a lot of people freak out when they hear hospice, like, "Oh my gosh, I'm dying tomorrow." My mom has been home with hospice for a year now, and she actually was not supposed to survive the
Yeah.
hospital. So she came home with hospice back last January, and you talk about a strong woman. I guess God's not through her because she's hanging in there and keeps on plugging away. So I
Yes.
Yeah.
understand what you're saying.
Yes.
It does have
Yeah.
some stigma, but let's kind of eliminate some of that today.
So let's talk a little bit about someone with dementia and if they are appropriate, because there are diagnoses that you guys have to look at that are appropriate for hospice care and some are not. So talk to us a little bit about that.
Yes. So one thing that we like to do when we're speaking to providers or the community is to allow our clinical team to assess, right? So we don't like to go in saying no, they won't be appropriate because sometimes there is something in that diagnosis that
Yeah.
may be. So we like to have people to have the conversation. So with dementia, there definitely has to be some other things along with it. So, for instance, they need to be unable to like ambulate without assistance, unable to dress without assistance, unable to bathe. So, some of those ADLs in there, and sometimes some other disease states. But like we said, some people will say because some things changed. So they may say, oh, dementia, well, they're not appropriate right now. But we always say, let us assess and see. Because
Mhm.
sometimes as caregivers or if the they won't necessarily see everything that our clinical team will see. So we
Yeah.
say, let us get in there and have a conversation with the
Sure.
family.
Sure.
Mm.
Yeah.
Now, no pressure, Tia, but Mary Bird said you're very knowledgeable, so you're good. You gotta show us now.
Thanks,
So,
Mary.
and talking about diagnosis and stuff though, for hospice, and Mark, your mom being on hospice for a
Mhm.
year, having done nursing home, everybody gets tired of hearing me say that. I know, but it's what I know.
No, we don't.
So having done nursing home for all these years, I cannot tell you how many people I have seen that have gone on to hospice and come off of hospice.
Mhm.
They've
Yes,
gotten better.
graduation.
Yeah, so
Yes.
I mean, they have, and even in a nursing home setting, and I'm being honest to say, in the nursing home side, it's a little different for us because we live with those people. We're there with them every day, and so we are there giving the care and giving the meds and doing all those kind of things. At home, it's so different for hospice. The support is so different, for hospice, but still in a nursing home setting, even with hospice in there, and hospice does such a great job with pain medication and things like that we can't provide some of those things that we don't, not that we can't do pain meds, we do,
Right.
but it just depends. So hospice really does a great job with with some of that and stuff.
And also just the support. So, and I just met you, but I love hearing about, your nursing home experience, interested in it myself, but it helps also because sometimes you may be low in staff. And when hospice is in there, at least there are those patients who had those extra eyes and extra care.
Yeah.
And so we really love when nursing homes or ALFs are open to us coming and being able to share what we can offer, which is
Yeah.
pain management, the support, of course, the social worker, chaplaincy services, just those extra touches that
Yeah.
sometimes when people are facing terminal illnesses, they may not necessarily get. So,
Well,
Well,
and
and the education and support, because I know you do the education for community
yes,
education stuff, but the education and the support that you guys give to families, because the nursing home staff can't do that. We don't have
right,
the time to do that,
exactly.
and we are not trained in some of that. I mean, I've sat with a lot of families and let them cry in my office and done whatever, but I've never truly been trained to go through that, and to have the chaplain service and some of those things is just wonderful for hospice to provide. So yeah, I'm
well, I
sorry,
think
Mark.
that's okay. That's all right. I think what some people need to understand, because I had to learn this myself, was when you whether it's at home, hospice will go wherever the client is
Yes.
at.
Mhm.
And
Right,
also, but hospice is not going to be there every day, day in, day out. Some people, may unknowingly think that, okay, if I get hospice, they're going to be here as a caregiver as well. That's not the case. So a
right.
lot of people mistake that as well. The hospice is a supplement to the family taking care of them, or them living into a assisted living community or a memory care community or whatever, but hospice follows them wherever they are.
Mhm.
And then especially for us, just to kind of tag on to that, sometimes there are times when you need extra care or the
Mhm.
caregiver may need respite.
Mhm.
And it's an ongoing conversation. So that's why when someone is, just enveloped with hospice, those things, people are in there to assess those things.
Yeah.
So
Yeah.
the caregiver may need respite, or there may be some days where there just needs
Mhm.
to be an extra CNA visit or extra nursing visit. So
And
that's also a positive.
yeah, it is. And when you talk about respite, and I know, Mark, we're going to go with hospice versus palliative care in 1 second, but when you talk about respite care, I think that is such a huge thing for families to realize when you're talking about hospice care too, is that, hospice comes in and you're not just there to take care of the patient, because you have social worker and you have a chaplain,
Mm.
at that point in time, the patient may not be in need of the social worker or the chaplain, but the family sure might.
Mhm.
And
Right.
you're there to love on that family and to give them the support that they need. And hospice knows, and this is what I want families to know about you guys too, is that hospice coming in and the nurse assessing, even the social worker coming in and talking with a family member and just hearing, somebody's listening to you. They do hear you, and they're going to know, you guys are going to know if there is, you know what, we need to do respite for you guys because you need a break, or the patient has taken a different turn and we need to do something different there. So, you coming in and assessing and being at home with people is just, I think, key.
Yes, very, and it's very needed. And once they because we like to do the 5 touches at Affinity Hospice. So when someone comes home, wherever home is, there is just that overflow of we're here for you for whatever you need. And then, of course, if there's something they don't need, but usually they're very open and receptive to it. Like I said, especially a chaplain coming to talk about, your spiritual needs or your spiritual questions with them, or sometimes simply just to hold your hand and sing a song. And the caregiver
No,
gets
it's not just spiritual, but it's mental health as well.
Yes.
Yeah.
Very
Yeah.
much.
It is for the caregiver. It's huge. So if Mark throws this little reminder, this visual,
are you ready?
One more time, we're going to talk about the difference in hospice and palliative care, because there is a difference.
Yeah. So that's an interesting, worthy topic.
Yes. So I like to say it how my manager kind of instructed us on how to think of the difference is that palliative care is a hospice appropriate patient, but there's a barrier. Maybe emotionally, they're not ready for hospice. Like we said, people like to say, hospice is the H word, or there's some other type of barrier. And we like our patients to know that with the palliative care, they'll have a nurse come in there and there'll be some monitoring, but it won't be all the services that are provided by hospice. Like if they need durable medical equipment, the CNA visits, chaplaincy, social worker, and things like that. So it's sort of a way to, I guess, for lack of a better term, ease someone into knowing what hospice services could really be able to offer them.
Yeah.
Okay. So adding to that, so what basically, if palliative care will not provide the equipment, like you're saying, like if someone needs the bed or the diapers or the oxygen machines, palliative care doesn't do that, correct?
Right. They won't do that.
But they do bring in the medical side of it.
Yes.
Okay.
And then we have the observation side of it.
Okay.
But all those and usually they need to still be hospice appropriate. So if they were to change their mind or say, okay, this is what I want, they would then be able to transition into hospice services.
Yeah. And I think I want to add to that, and I think we all understand that there's so much that does come with hospice that takes such a load off of families.
Yes.
It just really does. And it is such a misunderstood thing, because I used to, before I got
because
involved
everybody thinks, well, it hadn't been that long ago that everybody said, well, if you're going on hospice, that means you only have 6 months to live.
Yeah, if that.
No, that's not what it means. Now there are some diagnoses that may very well fall into that category. But if I'm not mistaken, and Tia, you have to correct me because I don't know all of y'all's everything on the diagnosis and all, but COPD is one that qualifies, correct?
Right.
But that doesn't mean that you've got 6 months to live. Heaven's sakes, there are people walking the streets every day that have COPD. It depends on your level, where you are in that diagnosis. But people walk around with oxygen tanks nowadays, and they've gotten so small and all those kind of things. But that doesn't mean that you might not need, because there are people that live alone. And so that hospice support, even for something like COPD, truly could keep them from ending up with a diagnosis that gives them 6 months to live if they would just reach out. And
that's a good point, Ann. If people would, like you were just saying, Tia, if they would just start out with a palliative care, in other words, get an assessment and let the assessment show, okay, what are the next recommended steps? And if people would quit being so resistant to it and get the stigma out, that it's such a way to have a better quality of life for their loved one, take pressure off for themselves, because I guarantee you something's going to happen that you're going to wish if they were already on palliative care or hospice, we would not have to rush to the emergency room. It would be handled here at home.
Yeah.
Right.
So,
And so I'm on both sides because I've been a caregiver, still am a caregiver long distance, but I think sometimes caregivers feel, and I just had a conversation with a mother last week. The son is terminal with kidney disease, stopped treatment, but she wasn't open to hospice, although she needs the help, right?
Yeah.
She needs it, but I think they believe that they're giving up on their loved one. And so
Yeah.
whenever I'm talking to them, I'm just like, it's not giving up, it's giving you a chance to really be able to spend more time with your loved one, really. Because when you're rushing to take care of them and helping them
Yeah.
with their ADLs,
Mhm.
you're already exhausted. And if you
Yeah.
have to work or if there are other family members, so you can't give everything that you would love to those special moments, that
Yeah.
you want to remember. So
Yeah, exactly. And go ahead, Mark.
Now, Mary Bird asked the question, can a person graduate off of hospice?
certainly can,
Yeah.
yes. And like Ann was saying, a lot of times what happens is that because when we're terminally ill and you're going back and forth to the hospital, so your body just gets battered, right? You get weaker a lot of times. And what happens when hospice comes in is that there's that love, there's that medical care, there is the relief for the caregiver, and people get stronger, like you said. And
Yeah.
yes, they graduate. We
Yeah.
have
Well,
patients who
And
graduate.
Mark, you were talking about the mental health side of it for caregivers. And I want to say this, and I don't want people to think I'm, being horrible to say it this way. But when you're caregiving is hard.
yeah.
It
Very
is hard. It is harder than people realize.
It's
And
very
you've
hard.
got to stop and realize that we're human. And when you're taking care of somebody all day, in and out, and you're providing ADLs, that means that if they can't toilet, you're helping to change that brief. So you're helping to change them, and they're going to have accidents, and then you're going to have to strip a bed, and then you're going to have to, and at some point you would not be human if there wasn't some kind of resentment
Yeah.
that
Yes.
hit you.
Absolutely.
And so
Right.
having those extra hands, helps to eliminate a lot of that for you.
Well, it's good you said that, Ann, because it's so true, because everybody has their own limits. And what one person's limit is doesn't make it wrong for another person not to have those same capabilities. And what I'm getting at, transparently speaking, is I'm not the type of son that can go in and deal with doing things for mom when it comes to feminine hygiene, seeing mom naked. I'm sorry. I mean, I'm sure there's some people up there that can step up the plate, but it's not in me. And that may sound weak or cowardly, but I'm just being honest. And so it gets back to where some people resist reaching out for the help that's readily available because of pride or feeling like they're doing something wrong or whatever, when you're not. But what you said, Ann, is so true, is it's almost like any category in life. Just because your loved one's getting older doesn't mean you're supposed to abracadabra know how to be a caregiver. And Tia, you can understand as well. I'm telling you, you are making a huge mistake if you try to give for your loved one and you don't get some training in dementia if they have one of those diseases that fall under that umbrella. You're doing far more harm than you realize by not understanding and knowing the behaviors and knowing how to respond and how to act, because you actually can make their life more complicated by saying and doing the wrong things.
Yeah.
Yes. And like I tell my residents or clients or consumers, whoever I'm working with, you can always say no, right? So you can start the services. So say yes to the help. And if it's something that you don't want or you feel like it's overwhelming, then you can always say no. But when I'm out in the community, as I often am, I always hear that either I wish I knew more, I wish I knew about hospice before, and I wish I didn't wait so late.
Yeah.
Because
And
one of the beautiful
go ahead. I'm sorry. There's a question. Go ahead and finish now. There's a question that's come up.
So I take a picture of Jimmy Carter when I'm in the community. I put that on my table because to me, that's like one of the beautiful hospice stories. And like we were mentioning with COPD, don't wait. If you qualify for it, get it so that you can be as strong as you can be.
Mhm.
Your caregivers can be less stressed, because caregiving definitely is a hard job.
Yeah.
Like Ann was saying,
Yeah.
because I've been there, and it was with my father. So Mark, just like you said, with the, feminine, masculine thing, my father was a Vietnam vet. And I wanted him to make sure that his dignity was intact, and that I wasn't doing things that would make him feel, some type of way, or not as strong as, he
Yeah.
was.
Yeah. Yeah. Because so many times they don't want you doing that
No,
piece for them.
Right,
no, not at
exactly.
all.
Right. But a nurse coming in, it's it's
It's
different.
different. It's a nurse. It's a doctor. It's
Right,
whatever. Yeah.
right.
Yeah.
Yeah. Angel asked, does insurance fully cover hospice services? So if you don't mind, give a quick little synopsis, because we are in open enrollment this season for Medicare. And so that is a complex field to navigate, and there's a lot of changes. But with that said, address the question, if you don't
Yes.
mind,
So
about how insurance covers that.
insurance covers hospice, Medicare, Medicaid. Also, like at Affinity, we also do accept some charity cases on a case-by-case basis if
Oh,
those
that's nice.
barriers are there. And then also, so we like to call people collaborators and not competitors. If there's an insurance that we don't accept,
Yeah.
you reach out to another hospice partner and say, hey,
Yeah.
we don't accept this. Do you all, or you sometimes will know? And we just want to get the patient the help that they need.
Yeah. And I'm glad you said that, because a lot of people, there's, and obviously for people that may or may not know, I know you do, Tia, and I know you do, Ann, the state of Georgia makes it very easy to open a
Yes.
hospice company. So there's so many out there, but again, there's a huge need for it. But like Tia's saying, there's different insurances that are accepted, programs, this and that.
Yeah.
But there's plenty to go around. We all do share with colleagues the opportunity to serve the families.
And then I'm just going to throw in there, Mark, since you're talking about that, to answer the question too, because it's different for someone at home than it is for somebody in a nursing home. Okay. Because what people need to remember is that still their insurance is going to pay. That's fine. They're not going to have a problem with that. Medicare is going to pay. And if it's an insurance that your company happened to take to you, then they would, pick it up, and y'all would be able to do that. But hospice in the nursing home side, it just depends on what their coverage is, because Medicare may pay for that hospice coverage, but the family may still end up paying for room and board. So they have to watch that.
That's a very good point.
Yeah.
And
so
I
they
think
have to watch that, and they have to know if they're going to have to pay room and board, and how that's going to work with them.
And we've touched on that, Ann. I'm really glad you brought that up, but that we do have other shows. But just real quickly, what Ann's really, again, I add to that is when it comes to moving into assisted living, memory care, skilled nursing home, that's when your assets are looked at. If you go into skilled nursing or nursing home, they're going to look at your assets and go, are you able to pay? Keep in mind, it gets complicated. Like Ann said, insurance will still cover hospice and palliative care, but you're going to have to come out of pocket for the quote unquote room and board, if that's the best way of putting it. So that's the difference between assisted living, memory care, private pay, or going into skilled nursing home. If you have assets, you're going to have to private pay and spend down until you spend all your money. That's why
that gets into Medicaid. Now, spend down and all that goes. If you're going to go Medicaid, it's not going Medicaid, then you're going to pay it out of pocket.
We have a lot of shows on all that stuff, but anyway, just want to kind of add on. So with that being said, we kind of have touched on it, but being a self-advocate, Tia, kind of break down the hospice ice with your provider. What does that mean?
So that means just there are some providers who are really on it. When I go in to visit them, they understand hospice and they're willing to talk to their patients about it. But on my end, like a community educator, it's really empowering the community to talk about it. Like, what does hospice cover? What does it mean? Does it mean that, you are going to be passing away immediately, like we discussed? Or does it mean that, you would be able to stay at home, or you can't be at home? So it's just really empowering and educating people to know what they will need for care. So the conversation needs to begin as early as possible, because I do other things as well. but care needs to be holistic, just like how we create trust and wills. You need to talk about what you want, how you want to end your life or live your life. If you have a terminal illness, what does that look like for you? You need to have those open conversations with your loved ones. And like home for the holidays, like this is a good time to talk about that.
But
And
it's so hard. It's
I
so
know,
hard
you
to
know
get
what?
people
I mean,
to
I
talk.
just, when you start talking about people making decisions, it just,
I know, but
I
we
cannot
did
tell
it.
you how many people I have seen over the years in nursing home, and we are a full code. We want everything done. And it's
Yes.
like, okay, it's really, we really, Mark, we really need to do a show on that. We really
Yeah.
do, and get some people on
Yes.
to talk about that, because there really comes a time to stop trying to save. I mean, there comes a time to let go.
It is. Yeah.
And
Yes.
it's hard. It's hard for families. And I think, Tia, you hit on that they feel like they're throwing in the towel and giving up on them. And you're
Right.
not giving up on them. You are giving them more dignity doing that, because I can promise you, if you put somebody through a full code and somebody starts doing CPR on them, they're going to break ribs.
Ribs.
Yes,
Yeah.
It's going to happen.
it's
It's going to happen,
difficult
and
to
it's not
watch.
going to go well.
Right.
And people don't want to talk about that. They don't want to talk about what we're talking about tonight, but they don't want to talk about that. And it is a serious
Well,
issue.
Ann and I cut up and we talk a lot about this, and I'll just say it out loud because it's true. We do this show because we care.
Yes.
We
we
don't
do
get
this-
paid anything for this.
We do this show because we know that there's so many people out there that have no clue what's available to them.
Right.
Zero clue. But no one really wants to watch the show, but you can post something stupid. You can have a channel over, hey, I'm going to sit in my car and smack on fast food, and you're going to have 1 million subscribers and 500,000 views.
Look, I'm going to say it,
goes
okay?
viral.
Because Mark's wife, and it's not stupid because it's the cutest thing ever if you ever watch it. His wife has a show called, and I'm going to advertise for her, called The Coop Scoop, because
Yep.
they raise chickens.
We raise chickens.
Okay.
And let me tell you something. She has over 12,000 subscribers.
Yeah.
I mean, she'll do one show where she walks out in the backyard and she's talking to the chickens, and Macy
chickens
is
are
one of them.
pets.
And I
Leah,
can't
it's
remember all their
crazy.
names, but she's named them all. And she goes through all that. And so that's why we laugh about this, Tia, because I have said she has over 12,000 subscribers, Mark. We can't get 200 people to listen.
Well, I am constantly brainstorming, and Mary, who was in the Q&A earlier, we're colleagues and friends. I have an idea with her. It's like we are going to increase awareness about this, because really the discussion of life and death, they go together. We have to erase the stigma so that people aren't torn at the end, not knowing what someone wants, families being torn apart from it, and it's really not honoring the person's life. So well,
giving real life examples, and of course, Tia, Ann and I are available to if you can bring value to the show, you can bring guests to the show that have gone through, we call it Caregiver Chronicles, to where it's people that have gone through living with their loved one and caretaking with the diseases of dementia. We have Caregiver Chronicles, to where people can come on and share their story. And it's almost like an extension of a support group, to where they can share their stories. It can allow other people to see what others have gone through. And like Ann said earlier, to be able to be honest and transparent, go, I have animosity sometimes. I struggle with my emotions and moods that make me feel so guilty, but we're not supposed to, there's no book to open up to go, how do you handle this? Hey, Kim. And so there's so much that's needed to be voiced. And I'll go ahead and let the cat out of the bag now. Another thing I've identified in being in this business is how messed up the discharge program is from hospitals and rehabilitation centers. Families are thrown to the wolves. They're like, here's a list. Good luck. Go find what you need. We got to clear the bed. And discharge planners and social workers and case managers can't love on the families like they used to in years gone by, because now it's a machine of get them admitted, How much can we charge for
Wow.
how long? Now we got to discharge them. We'd rather discharge them and have them readmit and come through the program again. So there needs to be more healthcare advocates. There needs to be more companies that are providing a service for a reasonable charge to have families be guided through what they need to do, what they need to say, because guess what? At 5:30, when the case manager's gone, you have nobody to talk to. So we're in the
Right.
process as we speak of putting together an advocacy program to take to the community. So there's
And
so
to
much.
give people a voice, right?
Yeah,
Because
absolutely.
Yeah.
yes, my previous administrator, I was helping because, of course, social work and this type of work is not a 9 to 5, right?
No.
Especially
Right.
if the community knows
Yeah.
about you.
Yeah.
So they were doing a discharge, like Mark said, and she was like, certainly they're not going to discharge him and leave him in the hallway. And I was like, they're going to discharge him.
Yes, they are.
Yes, they are.
Listen,
Yes, but it was
look, we have gotten patients in at the nursing home. We have gotten patients in at 10 o'clock at night.
Wow. Are you serious?
Oh yeah, I'm dead serious. Hospitals
Wow.
discharge them and they're set up. They are waiting on transport a lot of times. Hospitals now have companies that they contract with to do transport. So if it's maybe a non-emergent
Yeah.
and they do transport, well, those companies will subcontract. I've
Okay.
had taxi drivers that are subcontracted with a transport that have brought residents back to the nursing home.
Yes. And
Yes,
sometimes
and
with
it-
tubes hanging out, so they'll
Yeah.
discharge them home because I work with independent living communities, and it's like there's no one there to remove, a medical device.
Yeah.
But there they are. So yes,
No,
advocacy is
years
very
ago,
important.
this has been, Mark, that's nothing new. That's been going on. I'm telling you, 20 years ago, I had
Yeah.
that happen. 2 different residents that got dropped off, one by taxi. And I'm going to tell you, they needed to be so thankful that the taxi driver was such a nice guy. He came up, he rang the doorbell, he made sure the patient got back in the door because they don't have to do that.
Yeah.
I mean,
Kim
the patient
just
could
said,
walk. Unfortunately, she was from Germany and spoke very little
English. Yeah.
So
Yeah. Kim
it
just said she had a client that got discharged so late they didn't get home till 1 a.m. So you're like,
I don't doubt it, Kim. I've had them come in at the
They don't
nursing
feel
home past
good.
midnight.
They don't know who's home to, receive you or to get you prepared, to go lie down. Yes,
all
it's
I
very
know is
important.
this industry is not good for me because this getting older stuff, I'm like, oh my God, slow down, world.
Yeah.
But
I
yeah,
know.
is there anything else you would like to add before we go here?
So I'd like to add, when you see your community educator / hospice marketer come into your communities, just be open to listening, to them. We offer a lot of support, of course, our clinical services, but usually our employees or my colleagues are a wealth of knowledge and can help with, a lot of things or a lot of questions people have. So we're really there to build relationships. And yes, of course, we want the business, but we're there to be to build relationships and really be your trusted source for hospice care.
All right. What areas do you cover?
And so I service Clayton County and the South Fulton. And that's my area of service, and my number is 470-808-5098.
There she is.
There I
Anybody
am.
wants to get a hold of Tia? Tia, we both want to thank you for coming on to the show. This has been
Absolutely.
fantastic. If you ever have any other ideas or something of
I
value,
do. Can I ask one quick question?
you
Do
sure
all
can.
ever highlight any communities at all? Do you ever talk about any specific communities by any chance?
You talking about the assisted living or memory care?
Yes. Do you ever have
well,
them come on and talk about?
No, not well. Yes, we do. But of course, being a placement advisor, I like to introduce the people to those, ourselves. But we have had those come on the show. As a matter of fact, we've got one in the process that we're trying to put together so they can come in and highlight, because all communities definitely are not the same. They're all different for
Yes.
sure.
Yeah,
But
different amenities, different everything, really.
Yes. Exactly.
So,
Okay. Well, I'll be staying tuned in and spreading the word about the podcast show.
well,
Well, thank you. We
absolutely.
appreciate that.
You're
So
welcome. We
any
have to find something so we can go viral as well. We have to post
absolutely,
some
like
type of
There
I
we
might
video.
go.
need to, I maybe need to bring Donna's chickens in. We may have to do
You
Yeah,
may.
Maisie.
do that.
The Mark and Maisie show. So bring Maisie on.
Absolutely. But
Yeah.
we thank
Right.
you once again. But yeah, if anybody needs to get a hold of me or Ann, there's our email. But we here at CareQuest Solutions, we are not only just placement advisors, we help place families, of course, that are navigating the world of independent assisted living, memory care. Maybe they need in-home health, in-home care. We connect people with anything and everything they need. We do not charge for our services. We only get paid when we successfully place people. As far as the podcast goes, we thank everybody that does watch this. Please like, please subscribe and support the channel, and share this with any friends or colleagues that has families that are going through some of these days, because there are a lot of content already on the channel and there's more to come. And if anyone's watching this and you're going through a difficult or have been through a difficult, challenging time taking care of your loved one, go to the website, fill out, be a guest, and will be in touch to talk about it and possibly schedule a show for you to come on and hopefully leave something that impacts other people's lives. So I'm Mark and Ann. Thanks everybody for tuning in, and we will catch everybody on the next show.
All right.
Thank you.